Hey everybody, it's Lisa, owner of Peaches Skincare. Wear a hat. If you see me outside, I've got my lifeguard hat on. Get that blood flowing. It's like working out the arms or your muscles of your leg. Hi everybody, it's Lisa, owner of Peaches Skincare. You can visit us at peachesskincare.com, where you can see a little bit about who we are, the products that I developed over the past 30 years. And I also invite you to follow us on Instagram and Facebook, where we have a lot of before and afters, and you can see what our holistic beliefs in skincare are and what we can do for you. If you're new and just tuning in, I am 54 years old. I'll be 55 in February. And I try to teach you natural alternatives to invasive things for your skin. I absolutely believe in holistic. I have not done anything invasive to my face. In fact, I have no ring light and I am not putting, there's no foundation on my face. So if whatever you see is me and just getting a little blood flow to my face with massage and things. This is a series, we did microneedling, and this is a series on invasive procedures, what they really do, maybe alternatives, and just giving you some insight into these things before you think that they are the miracle that many times they are touted as. We are a society of instant gratification, and we want things now. To take care of yourself, your body, the health of your body, your skin, to anti-age takes time. It takes patience, and not a lot of people have that. I know a lot of people that, because they don't look pretty in a hat, won't wear a wide-brimmed hat outside. I know a lot of women who don't want to take the time to do facial yoga, and they would rather go and get an injection. And so I hope that these few videos guide you to understanding invasive procedures better and helping you to choose a natural or holistic alternative. Today we are going to talk about lasers. We'll talk about essentially ablative lasers or non-ablative lasers. So an ablative laser would be like a laser that caused injury to the epidermis and the dermis. It causes a controlled injury, and therefore they say that that creates collagen. A non-ablative laser would be like an intense pulse light laser, and that laser actually goes through the epidermis directly to the dermis, where it causes a controlled injury, and therefore they say creates collagen. Now, what do they really do? They really do cause an injury. They actually burn the skin. So a non-ablative laser doesn't burn the surface of the face, but it burns inside or creates injury inside. But an ablative laser actually causes a burn to the outside of the face. Now, these are my beliefs on what I have seen over 30 years, and this is what I have seen. But there are also scientific proof to back a lot of these up. Now, scientifically, they say that yes, lasers can actually cause an injury. They can get blood and everything rushing to the skin in a the easiest way to explain it, layman's terms, and then collagen rushes to heal the skin. But there are a lot of studies that show that they actually age the skin faster and cause so much damage to the skin that it ends up being damage that is at a cellular level and therefore creates damage that ages the skin quicker, and the skin is not as able to heal itself or protect itself from skin cancers or diseases of the skin. Now, I can tell you on darker skin, what I've seen is a lot of really bad hyperpigmentation. In fact, about 20 years ago, we had one of the first intense pulse light lasers, believe it or not. It was at our salon, and I did it one time, and this is what happened to my skin, and I've seen it throughout the years. My skin had a lot of hair on it, and it never really went away, and it also brought out pigment that actually made my skin look much darker and a lot worse. Now, why did it do that on dark skin? Because we have more melanin or melanocytes. And when heat heats up that melanin, it actually makes the darker spots bigger and makes the melanin darker. Now, what have I seen on lighter skin? On lighter skin, I see what I call the wax effect or the Barbie doll effect. Typically what happens is you'll see a line of demarcation everywhere the laser didn't hit. So let's say you only went down to your neck here, you'll see a line of demarcation here. Let's say you only went to here on your neck, you see a line of demarcation. And then all of this skin looks very waxy or doll-like. It doesn't look natural and real. And for some people, that might be what you're going for. That might be what you may like. I can tell you on both cases, women are then forced to wear more foundation, cover things up, because their skin just doesn't look natural without it. Also, you can see where there's this healthy skin, say right back here where the laser didn't hit, and all of this almost looks like a burn, like when you were a child, or if you've ever burned your skin and had left a waxy mark that looks like a different color. That's exactly what it looks like. I've also seen where people on fair skin and dark skin have had a test spot done on their cheek. Don't ask me why they would do their cheek. And they now have a non-pigmented area on their cheek from the laser. Now, the biggest thing that you need to understand is that laser can not only give you a right now effect and you feel like you're not going to look old anymore and you're going to get rid of those wrinkles. Again, we are a society of instant gratification, but it's the long term of what laser does. And most every study will tell you the effects do not last. You have to do it again. And I, for one, can tell you these women look crepier, more aged, and more wrinkled. So the other part of that is it's not going to matter if you don't take care of your skin. If you don't take care of your skin and you just go in and get an invasive procedure, it's not going to do you much good because you've got to have a good canvas to start with. If you don't wear a wide-brimmed hat outside afterwards, I cannot tell you. In fact, the other night or the other day, Kent and I were outside somewhere and I saw a woman that had had laser and some other procedures done, and she had no hat on. She was bright red by the time she left the area we were at down by the beach. You have got to take care of your skin because you have actually left it susceptible to having more injury. Now, what are the negatives to laser? I guess that's pretty much what I've told you. You can have redness and swelling and itching. I have seen, and this is a fact, it's ectopian. And what happens is, and I'm not sure if I'm pronouncing it right, they go under your eye with the laser. They don't want to get too close to burn your eyelashes. And the lid starts to pull down and roll out. And this is something that is a forever thing. You can have scarring. And I have seen on people's skin where the laser was, and you'll see these lines going up or to the side. You can have discoloration on fair skin and dark skin. You can have infections. So before you choose to do something so invasive, do your homework. Make sure you are doing this with a board-certified plastic surgeon who knows what they're doing. Ask around before you do something like this. And if you do still choose to do something like this, take care of your skin. Now, what are the alternatives? Exfoliating your skin, protecting your skin with a wide-brimmed hat, taking care of your skin so that you're a callus layer, which is usually what has a lot of the wrinkles in it. Now, when I say callus layer, I mean like the heels of your feet or your elbows. So in layman's terms, I want you to think of that as saran wrap on your face. Layer upon layer from years of sun damage and years of abusing your skin or just not taking care of it. Smoking, drinking alcohol, not eating a good diet. When you start to remove those layers naturally by natural exfoliation, I don't mean chemical peels, by alpha hydroxy, natural glycolic acid cleansers, grapefruit acid, papaya, sugarcane, lactic acid. When you start to remove those layers, baking soda scrubs, you will then get down to that beautiful soft skin. Now, my skin is not perfect. I do have discoloration from my dark pigment or melasma. You don't really see a lot of it, but I don't have crepey skin. I don't have wrinkled skin. I don't have saggy skin for my age. And it is because I have taken care of it and put the time in that it takes to have beautiful tissue and beautiful healthy skin. I hope that this resonated with you. Please subscribe to my channel, like this channel, and if you have any comments, comment with love below. And I hope you all enjoyed this and stay beautiful naturally.